I'm Major Carly Montpellier from Sudbury, Ontario, and I'm a Health Services Management Officer.
Health Services Management Officers, or HSMs for short, manage the delivery of healthcare to Canada's soldiers, sailors, and aviators. That's over 71,000 people across Canada and wherever our troops are stationed around the world.
HSMs are the ones that are working behind the scenes. We're not the ones providing direct patient care. So without the person coordinating the schedules in the background, making sure that the resources are available, making sure that people are adequately trained, then we're not necessarily providing safe and efficient healthcare. So really, we're the people working behind the scenes to ensure that can happen for our population.
Being a Health Services Management Officer in the Canadian Armed Forces calls for the same business and management skills required to manage a clinic or hospital in civilian life. That means managing all resources and projects to ensure that Canadian Armed Forces members receive a spectrum of care equivalent to what the most generous provincial and other federal government programs would provide in the same area. Additionally, as a platoon commander, an HSM may also manage their own team on overseas missions.
Some of the key aspects of our job, I would say, are human resource management, leadership, guidance, administration, planning, organization in terms of training and operations. So really, depending on what your job is within health services, it could look a little bit different. You could focus on more one area than the other.
Those numbers include the reserve.
The team is quite diverse, most of which are clinical trades. So some of the people that we would work with on a daily basis would be medical officers, nursing officers, physician's assistants, medical technicians, physiotherapists, mental health providers such as mental health nurses, social workers, so quite a large umbrella.
HSMs also have the opportunity to work in one or more employment streams: in the operational environment, personnel management, or in a clinical setting. As their career progresses, HSMs can be employed at regional or national headquarters or our national training facility and may have the opportunity to deploy on international or domestic operations.
My career has been quite diverse. I've had numerous deployments. I was able to sail with the US Navy, which was huge. I've worked with the Army, with the Air Force, so there's just endless amounts of opportunity. I think overall I'm extremely lucky and have had quite a beautiful career.